Hello, so we are going to apply a short leg cast. Now there are several ways to apply a short leg cast with different materials, but here is just one example and we'll discuss through it. So initially you apply a stockinette, okay, make sure it is long enough for the patient. This may be a little long, but we will roll it over later. You'll need about 4 to 5 rolls of cast padding. And if you want to incorporate compression inside your cast, you can also incorporate ACE wraps as well. And then of course the cast tape and a bucket of hot water as well. So initially you have to wash your hands and get gloves. Okay, so let's get started. Again, to reiterate, the ACE is optional, but for a short leg cast, you want the stockinette, so a 3 or 4 inch is acceptable. And you can make it a little bit longer, but not too long because we don't want to waste any materials. Okay, so you can start off in the forefoot. You want your patient to dorsiflex at 90 degrees. Make sure that there's no folds. If you have an assistant, they can hold the patient for you under the knee and dorsiflex at 90 with their other hand for you. Okay, so and then you can also go beyond the toes, and I extend it a little bit because again, we are gonna roll the stockinette over. So you can also put tongue depressors in this area to kind of make sure that there's no compression on the 5th digit or the hallux. You go up, make sure that there's no wrinkles, no folds. And then the cutoff really is the widest portion of the calf. If you want to go a little bit above that for the cast padding, that's fine. But then the real cutoff is 2 finger breadths beneath the fibular head because you do not want to impinge the common peroneal nerve, which could make the patient susceptible to a foot drop. But that is the absolute cutoff. Make sure that the heel is well padded to protect from any wounds, and make sure that their ankle is at 90 degrees because the distal 1/3 of the ankle does not have a lot of soft tissue coverage, and that is also susceptible for wounds. Okay, so this is the optional part where you can put ACE bandages on. So typically the foot can handle a 4 inch very nicely because it curves around the forefoot well. You can also use a 6 inch more proximally if you prefer, but this gives the patient some compressibility after, if you do like a case or if they're in your office post-operatively and they still need to be non-weight bearing. Okay, and then back to the cast padding. And remember, there's a plethora of materials out there. So we're using 3 inch and 4 inch cast padding. You may use 6 inch as well. That could be for the more proximal aspect of the leg. And then you could just use the 3 or 4 inch for the foot. I like to use a lot of cast padding just to ensure that they're comfortable, and when that fiberglass dries, that you know that they're in a comfortable cast. You don't want them calling you at 2 in the morning saying that the cast is too tight. You don't want them to have a compartment syndrome either. So if you notice, I like to put a lot of cast padding up at this angle because this is where the fiberglass ends. You don't want to be, you don't want to have a less amount of cast padding up there because again, like the fiberglass is rough, it can be sharp and cut into the patient. And then this is just like an optional 5th layer. This is a little bulky, but no wounds here. Okay, So then you take the fiberglass cast tape, and be careful because you have to be ready for, say, if you have an assistant to dunk it, right? So you don't want them to like unwrap all of these when you begin putting on the stockinette. You want to have them wait, so otherwise it will dry out. So you take this, okay, dip it in lukewarm water. So you have to wear gloves with this because otherwise the fiberglass will get on your skin. And then making sure that the patient is still at 90 degrees. Do not pull on this, do not create compression. This is just laying on gently onto the web roll cast padding. So you're not pulling this, you're just laying this on, making sure that you cover all aspects of the foot and ankle. Make sure that they're at 90 degrees, good. Don't want any wrinkles there. See, and so we have to hurry a little bit because this is starting to dry. So we don't want to have it dry before we're done putting this roll on. Okay, so that's one. And do two. Make sure we get all the way up. So notice I'm going to the widest portion of the calf because I don't want any swelling to bottleneck. We usually go from distal to proximal, but since I'm not putting compression, I can go up and then I'll go back distal. It's drying, so we gotta pick up the pace here and then make sure that this is put on nicely. Okay. So then we pull this down, and again, I probably could have cut this a little bit shorter. Okay, so pull this down, make sure that this is smoothed out a little bit more. This can fold, the stockinette can fold down to about this area. Same thing here. I mean, this is a little bit more than we need. So you have to make sure that the fifth digit is not compressed. So you can take those tongue depressors that you put in originally, or you can stretch this out, put your own fingers in there and make sure that there's enough room for the patient. Now, again, this is a little bit more stockinette that we need, but we don't want to have it too short. If you do that ace in the cast, you do want to make sure that the compression is towards the digits and towards the metatarsal phalangeal joints, because again, you don't want the bottlenecking of the swelling to be in the forefoot because that'll also cause pain. Doesn't look like anything's compressing. Does this feel okay so far?
Very comfortable.
Awesome, great. That's what we want. Okay. So then we're putting on the outer layer of the cast. Fold this back. Actually, that might make a smoother look. So this should be the last layer. So we use total of 3 fiberglass cast tapes, but you can do more if needed. Like, so if this didn't go up proximal enough, then you can use another roll of cast tape. We can go up a little bit more, use that 4th roll. And you want to make sure that this looks perfect and it's comfortable, because these patients may be in these casts for, 1, 2, 3 weeks, or if they can't come to see you, they may be wearing this for quite some time. And you're always checking, making sure that they're at 90 degrees. You don't want them to be in equinus. And make sure that they have enough fiberglass on the heel, because sometimes people rest their heel on the ground. And then you can take soap or water or hand sanitizer and then just smooth this out, create some warmth for that exothermic reaction. It'll be a little warm and then it'll be dry. Make sure that the tape is all aligned. 90 degrees. Right, and that is your short leg cast. Thank you.